I'm Dr. Amol Gupta, and I want to thank you for joining me on another episode of Medicine Mentors, where we interview masters in medicine, leading physicians at the top universities across the United States to learn from their experiences and derive key insights, traits, and best practices that can guide medical students and residents. Today, our guest is Dr. Stacy Higgins, who is a professor in the Department of Medicine at Emory University School of Medicine. Dr. Higgins graduated from Dartmouth College, received her medical degree from Cornell, and completed her internal medicine residency from Columbia in New York. She joined Emory in 1999 and pursued her passion for leadership in medical education, and was quickly appointed the Associate Program Director and then Director for the Primary Care Residency Program. Dr. Higgins has founded the Women's Clinic within the Grady Hospital to provide preventive care for female patients with limited access, and the International Medical Clinics, which focuses on providing care to minority and non-English speaking patients. She's led research on a variety of topics in the field of medical education, including humanism, reflective learning, mentorship, and diversity. She's the recipient of a number of prestigious awards, including ACP's Lester Henry Award for Diversity and Access to Care and Emory University's prestigious Papageorge Distinguished Teaching Award. Thank you so much, Dr. Higgins, for joining us today.
Thank you. Thank you for having me. I'm excited to be here.
Dr. Higgins, I came across an article that you had written on reflective learning and how it's critical to developing yourself as a good physician. Can you talk about what reflective learning is and how you've utilized it as you've grown in your career?
So I think the field of medicine is interesting because it's very prescribed and laid out for us what we're supposed to be doing, right? You know what classes you have to take to check the boxes in college, and then you know the tests and things you need to do to get into medical school and then to get into residency, and then if you decide on fellowship or your first position, and it's very laid out. There's not a lot of thinking, and then you come to work and you do your job every single day. And if you're not careful, you can just go through all of that without really thinking about how you're being transformed as a person and how your profession is transforming you. And how, being a physician is such a privilege to be able to, I say this a lot, you walk into a room with a white coat and people automatically, for the most part, will trust you with some of the most intimate details of their life. And you can come to take that for granted. And so really thinking about, what did I learn today at work? How is that going to change what I do with my patients tomorrow? I need to take a minute and think about what I'm grateful for today at work. What did I do to make somebody else's life better? And it can be things as simple as, this person was lost in the hospital and really looked distressed. And I took a minute to walk them to where the correct elevator was so they could go and visit their loved ones. Or this medical student was really confused about this particular point or felt really nervous about their first presentation. So taking a minute to giving them feedback was really meaningful for me. And so when I think about reflection, it's reflecting on those small moments that happen during the day, which turns into weeks, which turns into years, to show how you have grown over time. And are you going in the direction that you want to go? And if not, what do you need to be altering to reset that path?
Can you talk to us a little bit about your childhood, who your role models were, and what were some life lessons that were imparted to you early on, which have really stayed with you?
So I grew up in New York City, in the borough of Queens, in the city, Corona, actually, of Queens, New York. And it definitely shaped who I am today. Corona is a place that used to be very Italian and then changed to working class Black. And then over my childhood, there were a lot of immigrants that were from Spanish-speaking countries in the Caribbean. You mentioned that I direct the International Medical Center. One of the things that was very influential to me growing up is when I was in elementary school, I was surrounded by people who spoke Spanish. And so I actually started learning Spanish at a very early age because of that immersion experience that was not meant to be an immersion experience, but turned out to be so, and carried that with me all the way through college, and then looked at places I could work where I would be able to use that language. So that was an early influence for me. I will definitely say there are teachers who influenced me throughout my elementary, middle, and high school experience. People that I can look back on still and say, that was an amazing class. They were so available to me as a learner. I went to a math and science high school. I had the opportunity to take hands-on honors science classes with people who were passionate about what they were teaching. So not only did I learn the content, but also had early mentorship and people who were pushing me at a time when there weren't that many people who looked like me in the sciences. So to look at a young Black girl from a single parent household in a working class neighborhood and encourage her to say, yes, you can go on to be a physician. And there weren't a lot of people in my life who did that, but the ones who did, I still remember thinking about them and then seeing things within me that I may not have early on seen in myself.
I want to talk with you about mentorship and the role of teachers. You talked about how you were a young Black girl being raised in a single parent household. What is the role of mentorship specifically as it relates to those who come from an underrepresented or minority background?
I will say for underrepresented groups, in my career, I have had limited access to mentors that looked like me. And I do think there are issues specific to women, specific to underrepresented minorities, specific to first-gen students, that if you have not been in that situation, you may not understand or even think to ask about issues that are particular in those areas. And your mentee may not feel comfortable to bring those particular things up or understand that that may be influencing either the ability to progress in what it is that they want to do or advance in particular fields. So I think it's very important to have mentors who have had similar experiences that have navigated those waters before you and can talk to you about potential bumps in the road that may come up, how to get around those things and how to continue to advance and how to utilize everything that's around you in order to be successful and to keep moving forward. For me, I feel very indebted to the people who were underrepresented, who served as mentors for me. And so I definitely feel like one of my roles is to mentor other underrepresented students and residents and junior faculty members as they come up through the ranks.
You've been very fortunate to develop strong relationships with mentors, but some individuals go through their educational careers and they never really develop those bonds, those connections. What would your advice be for somebody who's not been fortunate to really develop that relationship?
As someone who is looking for a mentor, I would say don't give up, number one. Number two, think about non-traditional places where you can find mentorship. So if you find that you have made a connection with someone at a meeting, for example, regional or national meeting, who maybe is not at your institution, maybe is not specifically in your field, meaning in your specialty field, but you've connected with them and they are available to you, that is a potential mentor for you. Think about people that you're already talking to that you have not formalized that relationship and say to them, can we make this a formal mentor-mentee relationship and just talk every 2 to 3 months and just discuss what's going on with my career? And then I will also add, there are other means. So early in my career at Emory, we formed a peer mentorship group because we were having trouble finding mentors who are more senior to us. And so a group of us who represented different non-majority, so that we were all women or Asian or Black or Latinx. And we got together, there were a group of 7 of us, and decided that we each had different skill sets and were more advanced in particular areas, and we would mentor each other. And we would use the power of the group to have senior faculty come and mentor us as a group. So we tapped into people like Dr. Bill Branch, who I think you have interviewed, who was my division chief at the time, and said, this is something we want to do. We want you to serve as the mentor for our group. And then we can use your name and your cachet to help us bring in other people to help mentor us as a group and move us forward. And then we were able to hold each other accountable for particular things that we had set for ourselves. And so it was a year-long process, and it was very successful, I will say. We are all still in touch with each other. All of us have been promoted. Several of us are now full professors, and many of us are in different institutions and leadership positions. And so I think it was a great way for us to go non-traditional in finding mentorship.
Is this the Emerge group that you had published about?
Yes.
That was a very insightful article. I want to talk with you a little bit about success. What have been the traits and habits of the most successful students and residents who you've trained?
So I will say, one, figure out what your passion is. Everybody has something that they're really passionate about. And if you can discover what that is and then make it meaningful to the institution where you are, then you are golden, right? You're able to do the things that you love, and the people who you're working for find it valuable. So really think about, what is my passion? For me, that was working with women in an underserved environment and teaching them about primary health care for women, as well as being able to use my language skills in Spanish and caring for that patient population. Two, I would say, people who, in finding success for students and residents, find someone who is going to advocate for you, who is in that position to do that. For me, that was Bill Branch. He actually told me to come to him early on in my career and really think about, what is it that you want to do? Where do you see yourself in this division in 5 to 10 years? And how can I support what it is that you want to do? And then three, very important, particularly within the context of this podcast, find mentors who can help you shape what that vision looks like. That vision will shift over time.
So of all the elements that you've mentioned, what's one thing that you wish you knew when you started medical school or when you started residency that you really want all of our listeners to take to heart and practice?
I think one thing that I wish I'd known early on is that you don't have to have the perfect vision in order to go and sit down and talk with a mentor. The role of your mentor is to help you sort that out. And for a long time, I thought, I'm not really sure what this would look like or how I would do this. But that's really the role of a mentor, to help you figure that out. And so that is definitely one thing that I regret. I feel like I could have moved things along earlier in my career if I had been doing that on a regular basis. But my hesitation was, I can't come and sit down with a crystallized plan. But then what would I need a mentor for? If I had it all figured out, I wouldn't need them. And so I think that's really important. It's okay to just have some ideas, to have somebody to bounce those ideas off of who can help guide you and move them forward. It's really important to remember.
This was very insightful, Dr. Higgins. I'm going to try to summarize what you've told us into really 3 main points. I'd say the first one is the power of reflective learning, where we ask ourselves on a daily basis, what did I do today? But that's really not where the ball stops. It's, how will I change what I'm going to do tomorrow based on my experiences for today?
Yes.
And I think that's really a unique add-on to that question that a lot of people tell us to ask, but many times we ask and we just don't make a decision for tomorrow.
Right.
The other thing that I found very unique, and this will be kind of the second point, is that a lot of people say, find your passion. But what I've seen and what you've demonstrated in your life is you not only found your passion, but you've connected that passion with the needs of your community, of your hospital, of the university. And that's really created the perfect story, the perfect vision for your life. And the third thing that I found very helpful is we don't have to have a perfect plan to approach a mentor. It's really about being open to the idea of mentorship and approaching a mentor and saying, help me build that plan, help me build the vision. I don't have it figured out. That was really insightful, and I really appreciate you taking the time to come on.
Thank you. Thank you so much for inviting me. This was really great. I appreciate it.
To our audience, thank you for tuning in with us here on the Medicine Mentors. Thank you for joining us as we learn from the Masters of Medicine.